Okay, so we're going to get started because we have a lot of action. We have a lot of great material to cover. So, thank you all. Happy Wednesday. Today, we will be having a webinar entitled A Public Health Agency's Guide to Partnering with Faith-Based Organizations, the Toolkit Launch. So I am Dr. Lauren Parker. I'm on faculty at Johns Hopkins Bloomberg School of Public Health. And more importantly, I'm a member of the Health Equity Task Force of the Public Health Center of Excellence in Dementia Caregiving. So I could talk a lot about myself because I love talking about my research. But today, I'm just so excited to be here to introduce the center and then also introduce our moderator who would then follow up with introducing our wonderful speakers in our toolkit. So, the Bowl Public Health Center of Excellence on Dementia Caregiving, or some people refer to it the PICO, is designed to support state, tribal, and local public health agencies nationwide in developing their dementia caregiving focused programs and initiatives. So, some of the resources that we offer and we help, we improve access to evidence based programs and best practices. We facilitate collections and collaborations among public health agencies and a wide range of service organizations. As you can see here in the chat, so many here are represented now. And then lastly, we help your agencies identify, select, and implement effective public health interventions and strategies in caregiving. Please visit our website. We have a host of resources on our website. And if you see this QR code here, it'll take you directly to our website. As a reminder for today, just some housekeeping things. Please submit all of your questions for the speakers in the Q&A feature. We will have a moderated Q&A section at the end of this. Use the chat to share comments, resources, links, and ideas. We love to have the chat going on and encouraging dialogue. All of the recordings, slides, and resources will be shared after the event. And then to make this work even more better and to, just to continue to do this wonderful programming, we ask that you all complete a survey that will be provided at the end of this event. And this will help us create more programming and think about ways we can further help you all. And there also is a link to the survey, and you can use this QR code to get to the survey that will be at the end. So, pop quiz or pop question. You all are here, you have many different roles. In what capacity are you attending this event? Are you a bold public health agency? Are you a non-bold public health agency? A community organization or service provider? A person living with dementia? An interested caregiver or community member? A clinical professional or other? Please create the poll. It should have popped up on your screen. We'll give people about 20 seconds to do the poll. Okay, I think we can close the polls. And the results are here. So most of the people who are in the room today are community organizations and service providers. And that is followed by other, which is great. And then also people who are bold public health agencies and non-bold public health agencies. So great for you all to be in the room. Next slide, please. Now, I'm so excited for this. I get to pass the mic or the floor over to Dr. Fayron Epps. She is the founder of Alter. She is a professor at UT Health San Antonio in the School of Nursing, and she is a wonderful force to be reckoned with. So I'm going to pass the mic over to you, Dr. Epps. Thank you.
Thank you so much, Dr. Parker. Thank you for that introduction. You know what? When we did the poll, I am just wondering, since we had a large number of community organizations, I wonder if any of those community organizations are faith communities or places of worship. And so if you are representing a faith community or a place of worship, please put your shout out to your organization that you're representing in the chat. We would love to see that. But as mentioned, I'm Dr. Fayron Epps. I am a professor and endowed chair of caregiving research at UT Health San Antonio in the School of Nursing. And I'm also the founder of the Alter program. And the Alter program is a nationwide program where we partner with predominantly Black faith communities to equip them with the resources that they need so they can better support their parishioners and community that they serve. And that is really where this webinar, it kind of stemmed from the work that we were doing in our faith communities. And as I was out in the community, me and my team received so many questions about how do you partner with faith-based organizations? What are the best practices? And so I didn't want to make this webinar all about the work that we do. I wanted to hear from others and hear different approaches, other best practices to partnering with faith communities from all different denominations. And so for this next, I believe, hour or so, we'll be hearing from 4 panelists. The first one will be, well, this is not in this order, but I will let you know. You'll hear from Rachel Coney Bowles from the Virginia Department of Health, also Gerald Dermott from the University of Nevada in the School of Public Health, Robin Fraser, which is at the University of Minnesota Center for Healthy Aging and Innovation, part of PICO as well, a member of the Health Equity Task Force, and a site coordinator for the Alter program. So she has all of those titles, great resource person. And then additionally, you'll be hearing from Tiffany Turner from the Washington State Department of Health. And so as we hear from our presenters, I ask that you do take notes, put your questions in the Q&A as Dr. Parker mentioned, but I'm looking forward to having a lively discussion afterwards because this is so, so important. Our faith communities are really what remains constant no matter what goes on in society. They are still the most trusted organization in many communities. And I firmly believe we need to learn how to partner with them to get the resources to support out to all of our communities, especially those populations that are at risk for any dementia-related concerns. And so I am so excited to hear from everyone. I think our first panelist will be Tiffany. Oh, wait. I'm sorry. I was supposed to share with you all that our toolkits. And so as part of PICO, we have several toolkits that are available. And today you will also hear more about the faith-based toolkit that we developed, but this is on our website. Feel free to visit our website. We will put the link in the chat. But please, there's toolkits on all different topics, and we want to make sure that you all have access to that and you know that you can download it, use it, and share it. It's all about best practices. Next slide. All right, so next we'll hear from Tiffany about what they're doing in Washington State.
Hello, thank you. Good afternoon. So my name is Tiffany Turner. I'm with the Washington State Department of Health, and I work in our Healthy Aging program, coordinating our dementia grant from the Centers for Disease Control. And so I wanted to start off with giving you, well, first, actually, I want to back up and acknowledge those that are impacted by all the current changes that are happening. Sorry, go back slides. All the current changes that are happening at the federal and state levels. Just, public health has been impacted quite a bit. And I just wanted to give my heart out to all of those that are directly or indirectly impacted by these changes. So. But again, with Washington State Department of Health, I've been in this current position since July of this year. And prior to that, I worked in local public health for almost 20 years. So I had the opportunity to work with faith communities throughout my career. And it's been very rewarding. And I recognize what a great resource they are for us. So I was really happy when I took on this role to learn that Washington State Department of Health was also connecting with health with the faith communities. Next slide, please. So I want to give you a little bit of background about Washington State at the state agency level and what we're doing in dementia work. So our state developed the Dementia Action Collaborative in 2016, and the collaborative consists of both public and private partners that have come together to address the impacts of dementia in our state. And they were lucky to get legislative funding to support some of their work, and thus developed a Washington State plan to address Alzheimer's and other dementias. So in 2023, the Washington State Department of Health received a 5-year grant from Centers for Disease Control called the BOLD grant, and BOLD stands for Building Our Largest Dementia Infrastructure. And this grant is based on the CDC's Healthy Brain Initiative Roadmap, which guides public health and how they can promote brain health and address dementia. And so our work plan for this grant is really solidly based on our state work plan to work together to address this work in our state. Next slide, please. So back before Department of Health received the funding in 23, our Dementia Action Collaborative and various partners in that collaborative started doing a lot of outreach with the faith communities clear back in 2018, 2019. And they really started in, outreach and engaging with those communities and trying to build that trust, because obviously it does take a lot of time to build trust and relationships. And they really tried to connect with them by supporting the work that they're doing and really showing up for the programs that they were offering in their communities. So an example of that is Memory Sunday. So some of our faith communities were implementing Memory Sunday. And so staff from the Dementia Action Collaborative showed up for those events, and we tried to provide them with materials and programs that were culturally and linguistically appropriate for their communities, and supported them with materials and data. And so this picture is a copy of a fan that was created to hand out at Memory Sunday events. And the fan has this quote that was on the front, and on the back has little ideas and ways to address dementia risk. And so that was a really helpful resource that we provided. Again, we also work with them on addressing, understanding the disparities and the prevalence of dementia in their communities, and how different social determinants of health and other factors impact those disparities, and how can we work together to address those. So we continue to have really strong relationships from these founding outreach efforts to continue the work, and we really have created champions within our faith communities. Next slide, please. So based on those relationships, the Dementia Action Collaborative was able to start a pilot program in 2023, and they partnered with the First African Methodist Episcopal Church in Seattle, and they worked with their health and wellness ministry to create a program that would spread awareness about dementia, the value of an early and accurate diagnosis, and help them plan. And so it was really based on having them as the trusted messengers within their community to share these resources and messages. And so they promoted and shared resources on their websites. They conducted webinars. They participated in health fairs at their church, where they offered screenings, including many cognitive assessments, and posted links to resources on their webpage and social media accounts. So it was a really successful program. Next slide, please. So we wanted to continue the success of that program. And so when Washington State Department of Health started receiving BOLD grant funding, we wanted to create some additional opportunities to engage our faith and community partners in brain health and dementia awareness. So based on the feedback that we received from our pilot program, we heard from them that they really wanted a standardized curriculum to present to their communities. So we took BOLD grant funding, and we worked with a contractor to develop a brain health and dementia awareness in our community's curriculum, and then started working on developing a grant opportunity that we could offer faith and community-based organizations. And again, based on the premise that they are the trusted messengers in our community, and so we need their help to, again, increase awareness and educate people about the risk factors and early detection. And so this curriculum was created, and while this is being created, next slide, please, we started working on the development of the grant framework. And so we wanted to reach out to the different communities we were targeting. And so we tapped into some of our internal resources within our own agency. So our rural health program has many faith community linkages. Our community collaborative consists of many faith partners. Our community health worker network. We also reached out to Dr. Epps and Robin, that gave us a bunch of great information about the ALTER program and how they've implemented that in different states. And we really hope to work with them in the future even more. But they gave us some great ideas. We also worked with the other health departments that implemented ALTER in their states to understand what were their challenges, what worked best, and took a lot of their ideas, moved forward. We also reached out to existing programs like Dementia Friends within our state that already work with faith communities to understand, to create a program that's really going to meet the needs of those faith communities. During that time, the faith-based toolkit was also released, and you'll learn more about that later, but I just want to say, give it a shout out. That's an amazing resource that we found a lot of valuable information and tips for how to engage with our faith partners and ideas for how to build this grant. We also developed an advisory work group of community partners, including some of our faith partners, to develop the grant framework. They also helped us develop the application and the scoring tool, and they'll be helping us review applications, and they were instrumental in the promotion of this campaign. Next slide, please. So a little bit about the grant. So the grant offers up to $10,000 to community and faith-based organizations. And the intent is to promote brain health and increase dementia awareness. So the minimum that they can do for the grant monies is to attend, choose a trusted messenger within their community that would attend the trusted messenger training. And then after they complete the training, they will be required to go out and host 2 dementia awareness educational workshops for their community that they serve, and then minimal reporting requirements and program evaluation things after they are done. And so we just wanted to make it as simple as possible for them. We also understand that there's different levels of capability and capacity in organizations. And so we made a list of optional activities in this grant offering that they can choose for additional grant money, that they can choose to do additional educational activities. So like educational sessions on the different risk factors for dementia, or they could choose to do more programmatic activities that offer a little bit more funding to implement systems changes within their organizations or their church. And that might be things like making changes to make their worship services more dementia friendly, or it might be starting a support group for people living with dementia or for their care partners. So again, tried to make different options for different people's needs and levels of capacity. Next slide, please. So this grant does close this Friday on April 4th. There was a link there that you can check it out if you want. But after we go through, the advisory committee is going to be helping us choose our applicants, our awardees for the grant, because as of right now, we've received probably over 30 applications. And so it's going to be hard choices we need to make about who we're able to fund with this. And we want to be able to offer them technical assistance and resources to, again, be able to implement this grant within their communities, and then utilize the strengths within those organizations. So a lot of churches have health ministries, or they have existing, support programs that we can build on, or even have a lot of subject matter experts within their churches that we might be able to tap into to support the work of the grant. So like medical personnel that can maybe help do some training on some of the risk factors, or legal expertise that can help understand, the legal documents that should be in place. And then our hope is that we also connect them with other partners and resources in their communities that can help implement these or support them in these grant efforts. So one of them being the Alzheimer's Association, which for us was another great partner we worked with within our state that has a lot of faith connections. So make sure and reach out to your Alzheimer's Association connection. But also, their public health agencies are also, many of them are doing work in this arena, and other community partners like their Dementia Friends organizations that are happening. But we're really working on trying to assist them in building sustainable programs that can work beyond this grant funding. Next slide, please. So that's the end of my presentation. I'd be happy if you want to reach out to me to answer any questions about our grant, or provide you any support that you need for connecting with your faith communities. But they're such a valuable resource. So thank you.
Thank you for that, Tiffany. I have so many questions I wrote down, but we will wait until the end. But that is really good to hear what the state of Washington is doing and how you all are partnering with faith communities and starting on this journey. So I appreciate that. Thank you. And next, we'll have Rachel Coney Bowles that will now tell us more about the work that they're doing in Virginia with a program called Prayer and Prevention.
Thank you, Dr. Epps. Oh, my camera's on. There we go. Thank you, Dr. Epps, for the introduction. Thank you, everyone, for joining us today. Again, my name is Rachel Coney Bowles. I am the Brain Health Coordinator on the Healthy Brain Virginia initiative with the Virginia Department of Health, and that's out of the Division of Prevention and Health Promotion. So the Virginia Partners in Prayer Prevention program, it is a partnership that we have with Healthy Brain Virginia. You can go to the next slide. And so I'm here as a representative of a partnership. So as I do not work directly under Partners in Prayer and Prevention, I do work alongside their team to help with working with communities and that bridging those faith connections. So in 2016, VDH established the health equity, established the Virginia Partners in Prayer and Prevention. So this initiative, it aims to foster partnerships between communities, faith and interfaith organizations, as well as local, state, public health agencies. And so their goal is to address health disparities, provide education, and to build capacity within communities. Next slide, please. The P3 program, or Virginia Partners in Prayer and Prevention, it offers a comprehensive health education and capacity building efforts, equipping communities with the knowledge and tools necessary to improve their overall health and well-being. So through these collaborative efforts, the P3 program strives to transform health and create a healthier, more equitable future for Virginia. So in order to do this work, again, I mentioned those partnerships. It's very important. It's critical for the work that we do. And even under the Healthy Brain Virginia initiative, it's important for our partnerships and our partners network to ensure that, one, we have a unified and synchronized approach to how we are educating community members, faith community members, and then also a synchronized voice. So again, through many of our partnerships is how we're able to have so many different programs that we could offer, and including programs along the continuum. So the Walk with Ease program, the chronic disease self-management, partnerships with Stroke Smart Virginia, Quit Now, which is tobacco, and then the Healthy Brain Virginia program. Next slide, please. So the Healthy Brain Virginia initiative, again, that's the program that I coordinate. This is through a 5-year cooperative agreement with CDC. And so this initiative itself, as Tiffany mentioned earlier, it's an important initiative. It's dedicated to addressing the public health challenges posed by Alzheimer's disease or related dementia. And so what we do essentially enhance the public health infrastructure. So strengthening the capacity of public health departments to effectively respond to ADRD challenges, improve through infrastructure, expanding and improving the ADRD response. So employing a public health approach to address Alzheimer's disease with that emphasis on health equity and social determinants of health. Raising awareness and educating communities. So conducting community outreach, education, screening efforts to increase awareness about brain health, and empowering individuals with knowledge to make informed health choices, supporting caregivers, so providing that tailored resources and culturally appropriate resources to support services, and ensuring that they're equipped with being able to manage the complexities of being a caregiver or someone living with Alzheimer's disease or related dementia, ensuring equitable access to care, so advocating and facilitating access to ADRD care and resources across diverse and underserved communities. And then we utilize data to collect, analyze, and enhance understanding, enable us to plan strategically and implement effective ADRD priorities and intervention. Next slide, please. And so Alter, as that was mentioned earlier, so under the Healthy Brain Virginia program, we partner with Virginia Commonwealth University, and we fund their Virginia Memory Project, which is the Virginia Dementia Registry. And so through their partnership with VCU, we help support the Alter program. And so again, this program, it provides, that critical information on Alzheimer's disease and dementia, building communication outlets, the importance of early detection, and it really equips faith leaders that play that integral role in encouraging families to seek dementia diagnosis, and they also use local support services. Next slide, please. And so we also offer additional education. And so we mentioned that continuum of care. And so not only do we provide education and resources for persons with ADRD, but we also support healthy aging and preventing falls. And so the Saving Claire documentary is a documentary simply on the journey of a woman named Claire. And after she has a fall later in life, what does that look like? How is her care at home? Is she following all of the things that was recommended from her physical therapist, right? What that looks like. And working within brain health, many of you know that folks with a fall, they have a likelihood of having a head injury, and it can continue to evolve into a rapid exchange of treatment options for that person. And for many folks who want to age at home, after having a fall, it is more likely that they'll have some additional accidents that could prevent them from staying at home. So this is a nice documentary, and we have materials and resources that we provide to our faith communities as well. Next slide, please. Oh, this is her last page. Okay, so if you're wanting to know more about the Partners in Prayer and Prevention program, this is Veronica's contact information. But one other thing, a couple other things that I'll share with you before my time is up. We also offer a few other different types of resources. And one of the things that we've learned is when you have an opportunity to be in front of community and have a chance to interact, you have more of an opportunity to share of the other resources that you have available. And so sometimes we'll use this opportunity to either host community screenings while we provide, additional education and resources for caregivers or persons living with the disease. But we also have a community health worker education training that is free for all Virginians. And so the thing that's unique about this particular program is you do not have to be a community health worker to take this training. You just have to live within Virginia. But it's on a national platform, so folks all over the country have utilized this as a resource. And the thing that's really nice about this, about these modules that were created under Healthy Brain Virginia, it provides that foundation as to what training, education will be needed to know if you're caring for someone living with Alzheimer's disease or dementia. Then it takes a deeper dive into screening processes and communicating. So it really plants that seed of knowledge. It's a wonderful tool. We've had tons of great feedback, and then we also again, utilizing our additional resources. So we also offer the second wind training, and I saw Melora on here, so I wanted to mention that as well, because this is a really cool tool. It's the virtual dementia. It's the virtual dementia tour, and it's phenomenal. It really gets people thinking about what it's like living with the disease, and it really helps to see those behavior changes. And under this funding with CDC, that's really what we're wanting to see. We're wanting to know and understand what are those behavior changes that are coming out of the resources and information that we provide. So that's also something that we can offer to our faith communities. And then lastly, we offer them an opportunity to be a part of our Alzheimer's disease and related dementia commission. And so though they won't have a voting seat, they have an opportunity to join our work groups. So there's many work groups that we work alongside with our Department for Aging and Rehab Services. And so there's 5 different work groups that community members have an opportunity to share their voice and have an opportunity to help making sure that we're staying on top of our implementation plan. We're following alongside the strategies that were stated out within our dementia state plan. And so it's really helpful to have those community voices, especially with that faith-based lens to help guide and help us structure the way that we move forward. So I will drop in my contact information if you're wanting to learn more about the Healthy Brain Virginia program and additional ways that we can be support to you all. And that is all. Thank you.
Thank you so much, Rachel. Virginia is doing a lot, not just in that space of supporting dementia, persons living with dementia and caregivers, but just a lot in the aging space. So I do appreciate you sharing those examples. And I did not, and I was surprised to see the altar slide. And so I, again, attendees, this wasn't the purpose to make this about altar, but it's good to see that how altar is in the mix, working with and advising some of the states that y'all are hearing from today on their efforts to really connect with the community and support our faith communities. So on our next presenter will be Gerald Dermott, that is from the University of Nevada. And so I'm so excited to hear from him. His work will take a little different lens and also share about supporting faith communities in their efforts of supporting different communities. So not just focused on aging communities. So Gerald, I'll pass it to you.
Thank you so much, Dr. Epps. I really appreciate all of you being here today and being interested in this topic. I'm going to share a little bit about our program in Nevada entitled Why Faith Matters, Care and Resilience through a Health Marketing and Training Pilot of a Community Health Worker Program in Places of Faith. So if you don't mind moving on to the next slide, I currently serve as the Assistant Director of Strategy, Marketing, and Research within the Larson Institute at the School of Public Health at the University of Nevada, Reno. And in this capacity, we really work with a lot of our community-based organizations on incubation projects to really recognize the often unrecognized assets and community assets that different marginalized communities experience. And so we've had great success in partnering with faith coalitions and establishing and nurturing faith coalitions to actually get some grant funding and recognize the unique talent that they have. And so I'm going to be highlighting our community health worker program and how we certify our community health workers through Places of Faith and compensate our community health workers at living wages. So I want to do this through the lens of showing you a little bit of insight through their own voices and lived experiences through the documentary that I made, a short clip from the documentary that I made about this project. So next slide, and feel free to play it. Oh, go ahead.
I'm Bishop Ron Thomas, and in 2020, I was elected to be the chairman of the Nevada Faith and Health Coalition. Well, the Nevada Faith and Health Coalition is a coalition that's established to do a few things: remove the stigma that's associated with HIV and AIDS and mental health, and just to bring awareness and bridge the gap between the health community and the faith community specifically.
It's pretty exciting. I think you hear the scripture says iron sharpening iron. So in this case, you have professionals and those that are passionate for the things that you're passionate for, and laying down our egos to work for a cause that we think can make a difference in our communities. And so I think this is the exciting part of coming together and hearing each individual's stories, what they have accomplished in their various works, and how we can better make our coalition make a difference.
The gay and lesbians that are in your congregation, that is your congregation. That's not a separate community from the community. So when you start thinking different and recognizing that individuals have differences within your community and not living in separate communities, then you can really address the community as a whole and not separate people in the community and make them feel as though they're not part of the masses.
So it's important to bridge that gap because a lot of people in the church, right? A lot of people look at churches as religious, but there's a spiritual component to church. For some people, for myself, I'm a spiritual person. I'm not a religious person. It's important to me because when you talk about spirituality, you talk about everything. You talk about the mind, you talk about the heart, you talk about the way you feel, your perceptions, all these things, right? That's what makes a person. And the reason why it's important to bridge those two things is because if you're not in connection with your whole person and with your health, those things will not click. And so you could be the greatest person, have the most money, but your faith is not intact. And then your health is not intact because you're not putting those two things together. And so for me, I like to say that those two things kind of come together. You know, a lot of people are walking around and they have faith. They also have health issues, or they care about their health issues, but they're not putting those two things together. So the coalition kind of does that for us.
When you don't have a support system, when you have no support at home, have no support in the community, have no support in a job situation or family, and then you reach out to the church and then you have no support there, it's easier for individuals to fall off the grid, get involved in gangs, drugs, and an assortment of things. And I recognized that a long time ago how the church did not provide that support, even though it was always considered the hospital.
So it's our challenge to pastors to make sure that they understand that the Faith Coalition is here to help them be trained, as well as to train individuals in their congregations. We call that community health workers. It's our coalition's task to receive resources, to work with our state, and local politicians to make sure that we produce as many community health workers as we can to assist pastors, nonprofits in our community with situations such as COVID, HIV, AIDS, and mental health. Pastors need to know that there's help for them.
Thank you. And the reason that I wanted to share, and you could go to the next slide, the reason that I wanted to share this short documentary with you is just to center why it was important to partner with places of faith and why this is strategic both for workforce pipelining and also to elevate the health of our local community. So in this pilot project, which started as a pilot project about 5 years ago, it started with some initial HIV funding to work with Nevada Faith and Health Coalition and provide funding to the coalition to train and certify community health workers. In its initial pilot phase, the leaders, the congregant leaders at the places of faith actually were trained as community health workers, and then they got more people from each of their congregations involved. But we really saw the synergy and the value between faith institutions and public health programs, and we envisioned communities with a shared approach where we can improve health outcomes and increase resiliency through people that are trusted in their communities. So we embedded these partnerships and these community health workers in faith communities. We're able to get a grant because a coalition often can't get a grant and doesn't have the organization capacity. So we had a collaborative approach where we were able to partner with them in order for us to apply for the grant as the Larson Institute, being associated with the university and having that diverse portfolio to incubate the Nevada Faith and Health Coalition and to provide this training as well as the payment to these community health workers. And then these community health workers were placed within faith communities in our initial pilot. We had them at 10 churches. Now there are more than 20 churches where we have community health workers embedded within them. We have faith leader support, so we're leveraging our spiritual leaders to show their commitment and show exemplaries of being trained and certified as community health workers and letting that resonate throughout their entire congregations. So next slide, please. So why are we using community health workers? Well, we see community health workers as key to navigating the programs. They're from the community, they have community voices. I really appreciated how I can share their lived experiences through that documentary, but they guide through health and social services. They also provide specific resources that are aligned with the individual faith site needs, and they can be adaptive more than we can be in public health or government to the individual needs of their own faith communities. And then we really see this as peer-to-peer support. So these faith-based community health workers offer relatable community health assistance and are really seen as peers. And we also see it as a benefit for our public health workforce. So I am heavily involved in our workforce pipelining programs and on-ramping programs and realizing that we need surge capacity. We needed it initially in HIV and COVID-19 and mental health. Since that pilot program, we've expanded in areas such as environmental justice, hopefully soon dementia, and also have ways to support them with unintentional substance use and overdose prevention. Next slide, please. We really see this partnership as looking at a holistic wellness approach. where we already had community members that had the unique relationship with their communities with spiritual health. And how do we connect that spiritual health connection with physical health and social support? We see this as a holistic approach and not a siloed approach. So in working with our faith communities, we're really able to respond uniquely to the needs of spiritual, physical, and social support. Next slide, please. So we really see this in the engagement through proactive health promotion, where our communities of faith and our community health workers that are in the places of faith collaborate on resource integration. So they combine faith-based and public health resources effectively. They know how to communicate within their own communities. They also are actively involved in community engagement, involving going to prayer groups, going to community outreach events, and even going door to door in some cases. They truly also have a preventive focus. So they're emphasizing early interventions and long-lasting and trusted relationships through health education. We know that these communities have been marginalized in many ways, and these community health workers are really helping to rebuild the trust and this relationship building across a variety of health issues. And it's also an opportunity for these community health workers to possibly see career opportunities in working in public health and being and going through the levels of public health. So originally we only had community health workers at a level 1. With additional grant funding, we're able to certify community health workers at a level 2. They are employed through the University of Nevada, Reno. So with that comes some tuition stipends. With that becomes opportunity for further engagement, and that they're able to move up through protecting health and protecting faith and building community through community asset building and resiliency. Next slide, please. So we're also have an evaluation plan that we've done. We've done some evaluation reports that I'm happy to consult with you on, or if you're interested in this community, or share with you to see how you can integrate it into your own communities throughout the nation. But we continuously assess the current strategies and their effectiveness, working with these faith-based communities rather than government, rather than a health department. We're able to pivot and adjust the approaches based on community feedback and outcomes. And then we're able to refine those strategies to maximize the impact and collaboration by working with this coalition. Next slide, please. So with our synergy in action, we have strong bonds between our faith and public health partners. We enhance the overall community well-being through these combined efforts, and we see it as a win-win situation. So we're building the capacity, we're incubating the Faith and Health Coalition, adding to their portfolio of the grant funding they're allowed to get and administering it, as well as training and certify a unique workforce, and having a balanced approach of thinking about ways that we can integrate spiritual health and physical health as a co-created community responsive intervention. Next slide, please. In the future, again, we have this program that's been going on since pre-COVID, since 2019 and 2018, and these Faith and Health Coalition community health workers that are certified really were essential in protecting communities during the COVID-19 pandemic, and continuing on even post-pandemic of now working on chronic disease, environmental justice, substance use, and many, many other topic areas that we're able to be innovative and think about diverse funding sources to support these community health workers. In the future, we're looking to even further amplify this impact. So expand the reach of public health interventions and reach communities that are often unreached. We really appreciate and nurture our faith integration, where we're deepening our collaboration with our faith communities and looking to expand it not only in Las Vegas and Reno areas, but throughout the entire state, even rural communities. And then we have innovative programs and pipelining. So these new initiatives, like I said, we're providing an entry level or on-ramp into the public health community for these faith leaders by certifying them as community health worker level 1 with no tuition. They did so well that then we got additional grant funding to get them at a level 2 level. And they're working for us at the university, but they could also get jobs within their local healthcare systems. And we've seen them develop, and we even have our first community health worker that is now in a Master's of Public Health program on a scholarship at the University of Nevada, Reno. So we've really shed the light on this and saw this partnership as something essential to move the community forward, to recognize the assets that exist within faith-based communities and use it to improve a variety of health outcomes throughout our state. Next slide, please. Oh, sorry. That's all that I have. I'm happy to share the documentary, any of the evaluation reports, or even be a resource. So I'll put my information in the chat as well. Thank you so much for letting me be part of this important panel. And I really look forward to expanding our reach in areas related to later adulthood and dementia and brain health as well.
Thank you so much, Gerald. This was such an amazing presentation. We've had a lot in the chat and we have some questions. So please hang in there as I will be presenting questions after our next presenter, which is Robin Frazier. And Robin is from the University of Minnesota, as I mentioned earlier, and she's going to talk about a toolkit that we developed from our healthcare task force about partnering with faith-based organizations. It is our hope that this toolkit will show that it's not just one way you can, or one approach to partnering with faith communities, that there's varying approaches, but there's things that you should consider. And Robin, I will not steal your thunder. I'm going to pass it over to you so you can share with the attendees the components of the toolkit.
Okay, thank you, Dr. Epps. I'm glad to be here with you today. I work in the Center for Healthy Aging and Innovation at the University of Minnesota in the School of Public Health. I also work with Dr. Epps on the Health Equity Task Force, and I'm the Minnesota coordinator that works on the launch of the Alter program. We are so excited today to share this toolkit with you. And because the entire toolkit is available online for you to read through it, and it has an appendix and references, I want to cut my presentation down by 5 minutes because I can see that we want to have a full 15 minutes of Q&A. So if I'm going too quickly, let me know, but it's so important for us to be able to dialogue with all of you. And so when we launched the Alter program here in Minnesota, many churches and different faith leaders were saying, well, we want to do the Alter program. And I said the Alter program is specifically culturally tailored and bit by for the African American community. But we had faith leaders across in helping their congregation and community address needs. And so we put together this public health agency guide to help you partner with faith-based organizations. Next slide, please. And so this toolkit has 3 parts to it. In part 1, we want to just briefly cover the why you would want to partner with faith-based organizations. And I'm going to go through that part pretty quickly because you have already heard about the powerful programming that is being done across the country. We're then going to spend more time talking about recommendations for successful partnerships. And then we will also cover steps for partnering. How do you begin that partnership? Next slide, please. And so as we look at why the faith-based organizations, there's just so many attributes that they have, but faith organizations, they have been a part of communities for decades, in most communities. And so they're a place that people often consider their second home. It's where they have friends, they have family, It's where they have trust in the leadership and the ministries there. And so by public health, working with different faith based organizations, you're able to really advance not only, health promotion, but also able to help them address like Alzheimer's and dementia, which can be impacting their community. And so let's talk just briefly about what is a faith-based organization. And so faith-based organizations, they are religious groups, and they can be either registered or non-registered nonprofits. The key thing about a faith-based organization that differentiates it from government, public health, or private entities is that for the faith-based organization, you will see that their mission is spiritual and religious, is how they will describe that. These faith communities believe they have a moral duty to assist those in need and enhance the community condition of those people, not only in their congregation, but in their surrounding communities. And so if you're taking notes and you're thinking about who you can outreach to, think inclusive around faith-based organization. They can be include churches, mosques, synagogues, temples. It can include, like, we have a dementia-friendly chorus here. And so there's many organizations that have that mission focus on spirituality and health to address the needs. And so by working with them, you're able to help mobilize their resources and help them assist their congregation. Next slide, please. And so as we look at the faith-based organizations, one more slide, please, on this one. Okay. One of the recommendations that we have in part 2 of the toolkit is, as you take a look at successful partnerships, one of the really important things is that you want to join existing tables that have leaders and community advocates, so that you're not duplicating work that's already been done. And so you'll find that many spiritual and faith-based organizations, they have social justice ministries, ministries focused on health and wellness, ministries that are doing education. And so they are often already doing some work today. And so it's really important that we practice cultural humility and start by understanding what is already in place. So what is that organization doing? Who are their leaders, and understanding how they're serving their communities. And as you look at resources, you're going to want to identify those local resources, but there is also that opportunity to look at national resources that can assist. And if you'll go back one slide for me, Alicia. Okay. And so as you look at your partnerships, you want to have you and your team do that environmental scan where you are looking at which type of coalitions around faith and health are existing in your community. Many times there's interdenominational organizations, so understanding who's already active in your community is a very important piece. And you want to focus in on those that are already promoting healthy aging, risk reduction, and or they may be supporting families that are affected by Alzheimer's and dementia. And so by connecting with those leaders, you will begin to understand what needs are met, and then where are their unmet needs, and where might they need additional resources or information. One slide forward. And all right, thank you. And so part 3 that you will see in the guide takes you through a step-by-step of what we've learned as we've launched other faith-based programs. And so in Minnesota, we launched the Altar program as a pilot, and then Mississippi Department of Public Health came on, and they launched the Altar program also. And so when you go through the toolkit, you'll be able to see a question and answer from the leaders there, Dr. Kina White and her team. And so they talk about why they were focused in on a faith-based program, particularly in their rural areas where people had less access to resources and education. And then they talk about how they approached the work. And so you will see that in the toolkit. The toolkit also includes some options training that you can do. And it depends upon what your background is in aging, in dementia, in caregiving. For some of you, many things will be new, and for others, it will reinforce it. But we have all of that available for you in the toolkit so that you can see that. And we've already talked about the environmental and faith partner scan, which is there. And then we give you, as a part of the toolkit, some of the critical success factors in terms of your work in building a program to partner. Here, we wanted to make sure that we were very, very humble, and that we really understood what relationships already existed. So many of our faith communities were working with the Alzheimer's Association or the area agency on aging. And so we took the time up front to meet with the service providers and some of the healthcare systems so that we would understand what resources were available and could share it. And then we would be able to build upon that work. And so it's so important to communicate and do outreach with the other local providers and really spend the time to develop relationships. Patience is important because you're not going to develop that relationship overnight. People are going to need to meet you, get to know you, and understand the things that you can bring to the table, and that you have a genuine long-term interest in partnering with them. It's not something where you go in and you come out. And some communities in the past have experienced that. So they're going to want to know what your plans are, and are you going to be there and keep assisting them. And then on the next slide, and I'm going to end here, as a part of the toolkit, when you download it, you'll see there's references in there that include some of the research material and articles that have been published. And then there's a great appendix that talks about the role of FBOs in public health efforts to address dementia. And so you're able to see how churches and synagogues and temples, how can they mobilize their communities to address risk reduction, early detection, and supporting people living with dementia. And then we provide some dementia resources. So we want to thank many people on the last slide here that have contributed. This was definitely, if you go to the next slide, an effort that involved many people from the PICO advisory groups, university, and departments of public health that have brought this to you. So please download the toolkit and use that as a reference. Thank you. I'm going to turn it over to Dr. Epps.
Yes, thank you so much, Robin. And if someone can put, I was supposed to put the link to the toolkit or the link to the website. I don't think it has been placed in the chat, but if I can have a member of my team to do that, that would be so great. And also, if I can have members of the task force and presenters come off to show your camera and come off of mute, so we can have this engaging conversation. I see that many we have some question and answers in the chat, and many people have started responding to that. But I will go through the chat. But if you have some questions, please do put them in the chat. We have these experts and we have these folks that are in the field. They're doing this. Let's ask these questions. And I will start it off, right? I have a comment, then a question. And I'm hoping after today's webinar, you all can see that our faith communities are systems of care. In my world, they're systems of dementia care. And so that means they need resources, they need support. They're actually helping out and filling in the gap of the existing systems, making sure that their parishioners in a community at large are getting the resources, the support that they need. And y'all, we need to continue to do this. If we want to change this narrative that exists, if we want to improve health outcomes, we need to recognize that our faith communities are systems of care and partner with them, collaborate with them, make sure that our leaders have what they need. And they're not turning anyone around or providing the wrong type of support, which can be more harmful. And so we want to make sure that we support them. One of the things, Robin, you said, and it came up when the other presenters were speaking about that time to build trust. And I would love to hear from the presenters, because I know with the work that we do, many people think, oh, because you're a member of that church or you identify with that community, oh, it's automatic. And I would like to say that is not the case. And it takes time to even build trust, just like within your own family. It takes time to build trust within the community and extra time to build trust within our faith communities and places of worship. So I would love to hear from the presenters if you all can share about the time that it might have taken you to initiate your program.
If I can jump right in. So when I started on the Healthy Brain Virginia program in 2022, it was at a shaky time in society. And a lot of programs that previously existed no longer existed. So now we have to come in and say, I'm here, I represent the state, right? Let's start with that. And then two, I know we had this program for you and now this is no longer available. And so that automatically, has that undertone of distrust. And so it really took time to, one, build relationships, introduce myself because things were shifting, things were changing. So point of contacts had changed. So how can I, as a new person, come into this community whom I've never worked with before and explain to them that resources they previously had access to are no longer available, and I'm here to help them, along this journey. And so it took time. Roughly, I spent probably the first 6 months of my role just introducing myself to folks, putting my face out there and not asking for anything, right? Really just wanting to be able to say, what can we do for you? This is the support we have. These are the resources that we utilize. And they are in line with our CDC, objectives and goals. And so that comes with its own line of responsibility, right? And so being able to take that time and be patient, as I believe Robin mentioned earlier, that, it does take time to build up those relationships, and understand too that if you're not the right fit, you're not the right fit. Don't try to force a relationship to work, because that's gonna, tarnish the name and the reputation through community. So when you go to other churches, they're going to say, oh, no, don't work with that person. We don't like the way she does this, or we don't like the way he does that. So it's really important to um, learn how to lead from behind, right? If you can be okay with not being the face, but providing the resources, then, you can make it. But utilizing, those trusted voices within community.
Yes, thank you. I just got to give you an amen with that one, Rachel. Do not force that
Yeah.
relationship. And so I think that's such a good point for our audience to know that do not force it, because again, that can really turn out real bad and can tarnish your name in the community. Anyone else would
And
like to
I
share?
think,
I'm sorry, Robin, your hand.
okay, I was gonna say, I just to build upon what Rachel said, what I think is really important is approaching the community from an asset-based approach. Sometimes people go in like they don't know anything about Alzheimer's or dementia. They think they don't have doctors, nurses. I mean, these communities have and reflect the larger community. And so I approach it from, tell us about the great work you're already doing. And is there a way that we can help support you doing your great work? Because they're doing this work. It may not be on a website, might be not a ministry name, but they're doing the work. So cultural humility and respecting the assets. Thank you.
Yes. Thank you, Robin. Gerald?
No, I think Robin did a really good job of explaining that. The one thing that I want to say is that there are kind of two levels of trust. One, a trust in the information that's going out to the churches. And I think we already touched on, different churches or congregations might have different feelings about others. And that's why I think it was really beneficial for the leaders of these congregations to come together and say, we need to start talking together and we need to work together rather than living in our micro societies within our congregations. So just this establishment to start the conversation of this faith and health coalition where the leaders of these congregations are coming together was one part of it. The other part is that these are populations that often have been historically marginalized in some way, and maybe have a distrust of government, of the healthcare system. But within the communities, within these faith-based communities, these are people that were doing the generational work. This is traditional and generational work that has been protected for these communities over decades. So many of the people that we hired as community health workers have been informally providing health information, resources, social services for not only a few years, but a couple of decades within their congregations. And then to elevate their importance and say, you are uniquely qualified to go through this community health worker certification, and not only go through it, but also tell us how we can change it and make it better for you and your communities because you're the expert. And we're going to compensate you for that at a livable wage because we recognize the work that you've done and the unpaid labor that you put into your communities for so long. And I think that's how we build trust, and that resonates throughout the congregations and throughout our communities in Nevada.
Thank you, Gerald. You better preach now. I can tell you've been working with those Black pastors over there. That was so good. And you highlighted these points. I've seen all of these heart emojis coming up. Thank you for those words. Yes to everything that you said. I do want to look at our comments. I believe it was Sandra that spoke about faith community nursing. She noticed that it wasn't really highlighted in any of our presentations. Is there anything, our presenters, have you all worked with the faith community nurses within your region, within your state, to help with your program and partnering with faith communities?
So one of the things that we did in Virginia, we um, didn't necessarily go through the network. However, we did contract with a RN who was also a dementia practitioner, has had, 20 plus years worth of experience with Alzheimer's disease and dementia. And we contracted with her to help build out a healthy brain faith training. So she built out this curriculum, went into churches for free and provided this training with that nurse's perspective.
Okay, thank you for that. Anyone else? Washington, Tiffany, did you all partner with the faith community nursings?
So yeah, we have reached out to the different organizations for faith nurses to help also guide our programs, get input, and also help us promote these programs. And then again, we hope to tap into them as well with the different specific churches that we're doing awardees with, is that we'll work with them to as the subject matter experts within their congregations.
Okay, thank you for that. And so now I see this really good question from Ron, and hopefully I can capture everything that you're saying, Ron, but you wrote it in two different ways. Do you have any suggestions for families, individuals struggling with the challenge of various levels of understanding and commitment when religious interpretation guides them away from the needs of the individual that is really needing services and support? So let me see if I can kind of summarize that, because I believe I just had this conversation earlier. So when we are going into these faith communities, I think we have to recognize everyone has a different doctrine, right? They have different practices that they may approach and a different belief system. And sometimes, in my personal experience, when I have started out in this community, I am pushed. It was a lot of pushback because it was all about just pray, 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 and it would go away. Right. But I know that they had these parishioners right there that needed help and needed support. Have any of you all been faced with that? And for my particular situation, I was really early on in my career. So, y'all, I was caught so off guard. And if it wasn't for this psychologist that was sitting next to me, who is also a minister, I don't know what would have happened. She came in and just saved me and was able to show how medicine can align with faith, how programming can align with faith. So I would love to hear from others if you all have had that experience or any recommendations. And even my co-task force members, if y'all have any comments. I know I have not been the only one. uh, and so so moving forward, how I really operate, Ron, is I do my homework before I engage with any faith community, learning about their doctrine, their practices, and acknowledging that ultimately it's about that denomination or their practices, and these things that I'm bringing forth are recommendations that could help. And I think when I first started off, I wasn't using the word recommendations or suggestions. I was saying, this is what needs to be done. And so I had to soften my language and make sure that they understood that this is only recommendations and suggestions, and give examples of how this could help their parishioners.
And Dr. Epps, I'll jump in really quickly. I just knew we were going low on time, so I didn't want to belabor the time. But I think that you basically said what I would have said. I think I do a lot of homework ahead of time. But when you're partnering with these faith organizations and you're co-creating and co-developing these programs, that's what I have found to be most successful, because then it's embedded within their practices. It's embedded in the flow of how they would have it done. So it's not just the researcher coming in or the person who's supposed to have all the content knowledge. It's really a partnership. And so there's no, it's sort of like an equal playing field. And so everyone's voices are heard, and people, what matters most to both organizations, either the organization or the research, it seems to come together a little easier for me. And so those are the types of things I would sort of highlight, is that, that co-development, that bi-directional feedback, making sure that you're not overstepping, they're not overstepping into your lane either, but co-creating these programs, I think, have been most successful in the work that I do. So I'll stop there and hand it over.
No, thank you for that. And I do want to be mindful of time. And thank you, Patricia, for prayer, care, and medicine go hand in hand. Yes, that is the message we kind of need to go out, have out there. So Dr. Bashir Easter, thank you for tuning in. And you have a question about, do any of your programs have a youth caregiver component as it relates to training, jobs, and curriculum? Oh, it's just radio silence. So with that, go ahead, Gerald.
I mean, not specific to looking at caregiving and end of life and dementia and brain health, but one of the things that grew out of our faith and health partnership and this community health worker is the need within our youth communities. And because of this grant and because of the evaluation that we did that was so robust, we were able to apply and been one of 7 awardees nationally to implement a Black youth mental health policy project and advocacy project. And within that grant that we received, not only were we able to identify that, this was an issue within the congregations, but we were actually able to do a workforce pipelining. And now we do have a community health worker certification for youth that addresses the unique needs of youth. And we can hire them through stipends and through incentives to be part of that. And as they, become old enough, we can hire them and they can pipeline directly into those community health worker programs. So because of that initial seed funding, we use those evaluation results, and that's why evaluation is so important, to then identify additional needs, get additional resources, and pipeline this youth component that addresses the mental health needs, but also creates another avenue of workforce pipelining.
Yeah, Gerald, y'all are doing some amazing things over there. You might have to put your email and some links in the chat, because I think the stuff that you all are doing are great models that we can follow within our particular program of research or our topic area. So thank you for sharing that. And I do know Dr. Easter does a lot with the youth. And I would just say, for everybody that is tuning in, let's not forget the youth, and how when we're bringing programming into our faith communities, how we can show them that this is intergenerational programming, or how they can also support their youth through their programming. All right, and I think we will be ending in a few minutes. Robin, you have a question?
Yeah, just to comment about youth, one of the things that our community advisory board did at CHI is they selected some books and built a discussion guide, and we're just trying to find funding for it. And what they said, our community members, when they were interviewed by the CAB, is that ageism really needs to be addressed. And that even larger than stigma around Alzheimer's and dementia is the stigma and misunderstanding. And so we don't have funding for it yet, but we're going to keep shopping it. But it would bring together the parents, the child, and older adults in their life where they're reading books and they are having that discussion to increase the understanding. And so we don't have the stereotypical, this is what a grandparent is. And so I think that can be foundational to increasing the communication across the generations, because too many elders feel invisible.
Yes, yes. Thank you for that comment, Robin. And I want to think as I'm looking through the chat to make sure I didn't miss anything. And if I missed something, y'all, please repeat the question in the chat. This takes a skill that I did not go to school for.
Dr. Epps, one question that came up earlier in the chat is somebody wanted to know what are the challenges in helping the faith organization build capacity?
Oh,
Yes.
I have a lot of challenges to share. I'll share the first one and I'll get it started right there, real quick. One of the challenges is change in leadership. I think a lot of us go in and we work with faith communities and we just think that senior pastor is going to be there forever. And it depends on your denomination. Some of them are on assignment. And when you have a change in leadership, you're starting all over. And that has hurted the work that I've done in the community. Well, not hurt, but set us back because we're now have to relaunch everything again when we're working with the health ministry and someone rotates off, we starting all over again. And I think this is something that I didn't think about when I first started working in the faith communities. I just thought that they was going to be there forever. 5 years, they still was going to be there. But that is not realistic. And I think you have to plan for that in the beginning. So that is one of my challenges I am sharing. Anyone else?
Going to say one thing that we like to do is rather than have all the responsibility fall on one person is to kind of include like co-champions for the health ministry and then have them build out a team that goes across ministries. That way, when you lose one person, you're not losing all of that knowledge. And so if you're creating that dementia-friendly church, the welcomers, need to welcome people and understand who might need help. The ushers might need to escort someone to a quiet room. So we are trying to build teams across multiple ministries and have co-chairs. And that way you don't lose one or two people and it go away.
Yes, thank
And
you,
it's
Rob.
embedded, as Dr. Williams said.
Yeah, thank you so much. And I am recognizing the time. You're right, Melora. We could have been on here for longer, or we can have a part two. So never know. Stay tuned. But I do want to say for our administration, if you can put the link to the survey in the chat, because the previous link was not working. If you all can put that so we can make sure that we get that information. And Lauren, what's the link to the toolkit put in here? Did not.
Yes, all of
Okay.
that should be in the chat. And so thank you all so much. We have a lot of questions in the chat that are asking if the slides will be available and if you can share them. Yes, yes, yes. That is the goal of PICO, is to be of service to you all. So please feel free to share widely. Always connect with us. We have a host of webinars that are coming up. I see some people who talked about respite. I see people talk about transportation. We have a lot of things in the works. So always stay abreast to what we're doing by going and visiting our website. As always, you can follow us on, it used to be called Twitter, but now it's called X. You can follow us on there. And then we have a very active LinkedIn account as well. So please, please, please follow us. We love to share information and reach out if there's anything that we can do to support you all in your efforts. Thank you again. Happy Wednesday. You could have been anywhere in the world, but you came to be here with us. And we went over just by a little bit, but we had such great information. So I hope that you won't, you'll charge it to our head and not our hearts, as they say at the church. So thank you all and have a great afternoon.
Thanks.